For sure. My name is Juniper, and I'm a harm reduction specialist for the Transgender Resource Center out of New Mexico, based out of Albuquerque. And I've been there since 2023. I'm a trans woman of Choctaw descent, and I've dedicated my working life to helping members of my communities, particular focus on the trans community, Native communities, and the house community. I graduated from Southeastern Oklahoma State University in 2021 with a Bachelor of English with a writing emphasis. Went on to attend the American Indian Law Center's Pre-Law Summer Institute program hosted at the University of New Mexico. During this time, I also took a very intense personal interest in the field of harm reduction and began to gear my goals towards making harm reduction my professional career. I am happy and excited to present here at the summit, and I look forward to seeing everybody else's presentations. So if we begin with the history of the illicit and illicit opioid supply. Before fentanyl became common, most of the opiate drugs were either subverted from the pharmaceutical supply illegally or were manufactured illegally from opium poppies. The pharmaceutical companies had first began the opioid crisis by overprescribing. In more recent years, has begun to overcorrect and cut back on the amount of opioids they're prescribing, even when it might be necessary for like cancer patients or somebody in extreme pain or somebody in a deep physical dependence. And the result of doing this, essentially, is you move a lot of patients over to the black market. Because a lot of patients are used to a certain amount of an opioid drug they've been had for months to years. And when they're taken off of that, if they don't have the proper tools to readjust and to figure out how to move forward without the opioid drug as in their system all the time, then they are generally forced onto the black market with illicit drugs, and unfortunately a lot of the time it's cheaper, although only in the short run. At the same time, producing heroin from opium poppies to smuggle in large amounts became more and more difficult as America began to use more and more from the black market supply. And someone who's physically dependent on heroin, has a very strong physical dependence, can go through a gram or two just to stay well for a day or two. And that ends up being a lot of substance that you have to transport across borders. Because if someone with physical dependence can go through a gram in a day, that means that a kilogram is only really going to last you 100 people for 10 days. It's going to make you money, but for the amount that you're smuggling, it's very not worth the crime that you're committing. But when fentanyl came into play, that changed essentially the risk factor of smuggling drugs across international borders. Because now, whereas a kilogram of heroin will last you 10 people for 100 days or 100 people for 10 days, a kilogram of fentanyl is about 100 times more potent than heroin and can get you 100 times more profit. And with that profit motive in mind, it makes it a lot less likely that one would smuggle heroin across international boundaries. And a lot more likely that fentanyl, because of just how potent it is, how cheap it is to make, and how much easier it is to smuggle. There's just less amount that you have to smuggle for the same amount of users. And so here we just want to take a look at, like, these are the opiates these are opiates derived from poppy plants, and they're all known as morphine opiates. So we have this kind of structure shown over morphine, and this is the morphine structure. And so any drug derived from opium is going to have that base structure. And these morphines are most often produced in poppy plants. Most pharmaceutical opioid drugs are morphines. Most are not synthetic. There are a few synthetic pharmaceutical opioid drugs, but most of the common ones are going to be morphines. This would include hydrocodone or Vicodin, oxycodone, Percocets, stuff like that, generally. The most potent of these drugs, oxymorphone, is only about 5 to 10 times more potent than morphine. So still incredibly strong, but not really on the level of the synthetics that we're seeing. Morphines were the most common opioid drugs for about all of human history. Only in the past 100 or 200 years have synthetic opioids really even become a thing that existed. And because of this, it's only really been recently that we've had to learn how to deal with this. We haven't had a history very potent drugs like this that we can look back on for advice for how to deal with this. This is a very new problem, relatively speaking. And so this over here is the structure of fentanyl. And I know it can be a little bit complicated, but the reason I bring up these structures and not just talking about the drugs is because basically fentanyl testing strips. Fentanyl testing strips can read this structure, and it may be, a derivative. It may be different here or here or there, but it generally reads this same structure and can tell you this is a fentanyl or a fentanyl analog. The biggest problem with that is that we're seeing a new class of synthetic opioids come in, known as nitazines. If you can see here, a fentanyl testing strip would look generally and see it as this backbone, because anything with this backbone is going to be a fentanyl analog and have generally around the same potency of fentanyl. Nitazines, on the other hand, and this one, for best example, has about 1,000 to 1,500 times the potency of morphine, and yet does not have the same structure of a fentanyl analog drug. This means that a fentanyl testing strip may not be able to catch a super potent opioid cut into the supply, even if you use proper testing supplies. Fentanyl test strips can catch any opioid with a phenylpiperidine structure, which is right here, since what we've been going over a little bit. Essentially fentanyl and all of fentanyl analogs. Fentanyl test strips cannot, however, catch any opioid drug with a benzimidazole structure or nitazine structure. So you can see, even though it may look a little bit similar with like 3 of those rings and 3 of those rings, it's not similar enough to where the fentanyl testing strip would be able to read it as a fentanyl analog. So say, for example, somebody bought oxycodone pills, right? And they are pretty confident that they're oxycodone pills, so they look like they should. They test negative for fentanyl, and at that point, you think they should be safe to consume. However, while these tests can detect fentanyl analogs, such as carfentanil or sufentanil or fentanyl itself, they will not be able to detect any opioids with a different structure. So a nitazine structure, or if it was genuinely oxycodone, it would come up negative, because the test strip is going to look for the fentanyl structure and not for the morphine structure. But the nitazine structure can also fool the strip. So one may think they're consuming 10 milligrams of oxycodone if the test's negative, but these pills most black market pills are pressed with synthetic opioids, and if it tests negative for fentanyl, there's a decent chance that it is testing positive for nitazine. Through learning about these chemical structures, it can be a little bit complicated at first, but once we understand the reason why certain test strips work with certain drugs and not others, it can make it a little bit easier to figure out how to deal with the upcoming opioids appearing in the supply. For example, we have these nitazine test strips here that we can provide alongside fentanyl test strips, and that is extremely important for being able to recognize and catch a class of chemicals before it gets bad. Because if largely the nitazine structure is ignored and not tested for, we won't know that it's in the supply. And it could be even more potent than fentanyl, but we wouldn't even know because we don't have people testing for it. That's why it's generally pretty important to test your supply, because you not only let yourself know, but you can let the community around you know. And it's very important in the opioid crisis for us to be transparent with each other and all have similar information as to what the supply we have is. Xylazine is a new opioid sedative, non-opioid sedative drug, my apologies, that is being cut in the opioid supply. It induces low blood pressure, sedation, and respiratory depression. It is believed to cause necrotic wounds at the point of injection, but also seemingly causes open sores in the body from smoking as well. Working at the Transgender Resource Center in the harm reduction building, the harm reduction side of things, I helped run the syringe exchange, and we've seen a lot more people come in over the last few months with open sores over their body. And while we aren't sure, we can only really assume that it's from a mix of xylazine and general lack of ability to take care of one's own wounds. So without any proper medical supplies, it's hard to take care of one's wounds, and they can necrose further over time. One thing to note with xylazine is that it cannot be reversed with Narcan. So it is a sedative, but it is a non-opioid sedative, which means that Narcan doesn't really do anything to it. That being said, one should always administer Narcan in a suspected overdose situation because xylazine is most often caught with fentanyl, and if somebody's overdosing on xylazine, they're most likely overdosing on fentanyl as well. But because of that, it can cause a separate, distinct, and coexisting physical dependence from opioid dependence. So the physical dependence one would develop through tranq dope would be not one, but two classes of drugs. Because you have the opioid drug exerting its effect over the body, and it's fentanyl. But then with the xylazine, you have another sedative that's not acting on your opioid receptors, but instead on your GABA receptors. However, if taken enough, your body develops a physical dependence on it, and you need the tranq dope rather than just the regular dope to stay well. Another topic that is kind of similar to xylazine is benzodiazepines and the dope supply. So another complication that kind of arises out of the current wave of the opioid epidemic is benzodiazepine drugs being found in the dope supply. Like xylazine, benzodiazepines cannot be reversed with Narcan, and can cause dangerous amount of respiratory depression when combined with opioids. Benzos don't generally cause that much respiratory depression on their own, but taken with alcohol or opiates, any other kind of sedative really, it can become very dangerous, and one can aspirate on their own vomit or simply stop breathing. Benzodiazepines with opiates, like I mentioned, cause extreme amounts of sedation, which may render the user unconscious for most of the high, producing potentially dangerous situations, especially for our unhoused folks. Our unhoused folks, especially those like women, who just generally are a little bit more tend to be targeted, are in a very dangerous situation if they are unconscious for long periods of time out on the street. And it can, a big problem with this too is that with benzo dope, you end up with a physical dependency on benzodiazepines, which is generally more potent than xylazine. So benzodiazepines tend to have a very strong physical dependence and can actually cause seizures or death if you take a high enough dose of benzos and then completely stop. Benzos, like most drugs here that we're talking about, generally require a tapering period. This tapering period is what helps your body adjust over the next few weeks while it limits the chemical it's getting and starts to bring back its own balance of natural chemicals. The most common benzodiazepine on the illicit market today is the Xanax analog known as bromazlam. Sometimes pressed Xanax bars will contain fentanyl or another potent opioid, but benzos containing opioids are not nearly as common as opioids containing benzos. A bag of dope that is known to be an opiate dope is most likely going to have some sort of other downer in it besides just fentanyl. And a lot of times this is benzodiazepine, tranq, or it could just be some, like, even Benadryl is a decently common cut we're seeing in dope. It's not necessarily something that gets you really high, but it is something that sedates you and can make you think you're a bit more sedated and high than you actually are if you're using fentanyl and have a very high tolerance. Another recent development regarding benzodiazepines in the supply is a recent drug coming into the market called clobramazlam. Now this run is more potent than Xanax or really any other prescribed benzodiazepine, and it can cause blackouts at doses less than a milligram. The good thing about clobramazlam is that it is much less likely to be found than something like bromazlam, but if it does end up being in any particular dope supply, it will have a much, much stronger effect than something like Xanax or bromazlam. And this drug really is just replacing another very potent benzodiazepine that recently left the market after being banned, and that was clonazepam. So where are nitazines showing up? It's kind of difficult to gauge exactly where current drugs are in the supply, but we do have some data to work with. Hopefully that works, right? But I will click on this link and pull up this website called Drugs Data, which should show you a list of where certain drugs are popping up and what combinations they're popping up in. And what we can see is nitazines are showing up across a few cities in the US. You can see bromazepam is also showing up in a lot of the samples containing fentanyl and some of the samples containing nitazines. The picture of what is exactly in the dope supply becomes a bit clearer when you use this website. Most supplies of dope contain a somewhat random mix of fentanyl and nitazine analogs, unreactive chemicals, some active depressant cuts, which would be the benzos or the xylazine or the Benadryl, some inactive cuts, and perhaps a dash of heroin, but that generally tends to be pretty unlikely. Would you be able to click the link on that really quick? And could you scroll down just a little bit? So what we can see right here, and we're a little bit behind because recent drug status stopped collecting samples in April because they're moving to California, I think, but they're moving labs, and so they haven't been accepting samples for a bit. But what we do know is that it's appearing in different cities across the United States. The first one we kind of see it in is Boston, and we're seeing like metodesnitazine, protonitazine, xylazine, and fentanyl. And that is kind of a pretty potent combination of drugs, especially at that ratio, with like 23% xylazine, 17 fentanyl, 10 metodesnitazine, which is probably about as potent as fentanyl. And the 4-ANPP there is another kind of interesting thing to look at because it's one of those unreacted chemicals mentioned earlier. It's not supposed to be in there, but the chemist who was making the drugs did not exactly do their job right. And so we have unreacted like solvents and chemicals still being in the dope. And it's not in every batch. Of course, we can see here we have something that's labeled as black or tar, which is supposed to be like heroin. But obviously we can see it's a bit of, what is that, vitamin C, nitazine, benzoic acid, bromazepam, Benadryl, quinine, caffeine, and another nitazine analog. So what we're beginning to see when we look through this is that heroin is largely gone. It exists and it can be found in certain dope supplies in small amounts, but what's being sold is heroin. It's actually fentanyl, xylazine, unreacted chemical, nitazines, and more unreacted chemicals. And this has been the case for a while. I think a lot of people tend to think that heroin is still around in one form or another, and it is in very small amounts. But the majority of what any dope supply is going to be synthetic opioids. It is very, very difficult to find heroin nowadays. And even then, you're going to be paying a very high premium. Could you throw it back to the presentation? And so this is a very useful website for actually looking at what's popping up, where it's popping up at, and how to start dealing with this. It started actually as an ecstasy testing service in the United States, but is now accepting any drug samples to test from around the world. It currently has over 20,000 completed and posted test results to its website, and has an accessible and useful search engine to comb through results. I really appreciate this website, and I highly recommend community organizations utilize it, because it's not only something that we can find information that we're looking for, but it's also something that we can provide information for people that other members of our community that might need it. For example, when this data starts collecting samples again, some community orgs may be able to collect local samples of drugs and send them off, because that'll tell us what's in our local supply, what's in our community supply. Sure, we may know what's in other community supply, but if we're able to test our own supply, that gives our community a data point about what drugs are in our community, but it also gives other communities a data point as to what's in different communities. So the more we can test different communities, the more information we can help give each other. And I think that is very useful in being able to help treat each other, because it's not like we have these pockets of fentanyl crises affecting different communities, but it's one big crisis affecting all of us at the same time. Unfortunately, drugs data is moving locations, as I mentioned before, and so I have not been accepting new samples over the past few months, which limits our ability to see where new samples are and testing positive for nitazines. Especially in this current moment in the opioid crisis, there's a lot of new things popping up kind of constantly. It's a little bit hard to keep up sometimes. And so without collecting more samples, it's kind of hard to see what's been going on recently. However, once they get back up and running, I would highly encourage to keep checking on them just to see when they do get back up and running, and when you're able to send your own samples in, and maybe we're able to get more specific knowledge in our community. And drugs data does charge $100 to $150 depending on the sample set in, which is why I recommend community organizations do it, because most users don't have the resources to do that themselves. Most people really don't have the resources to do them themselves. So community organizations being able to send this in for their community members is very, very helpful. But this limits access to people who use substances to test their substances. However, each sample sent in not only gives information about the substance to the user, but also to the community at large about what substances are in any given batch. This does, however, skew results towards wealthier areas. It makes it more difficult to see us in the supplied areas that have faced economic depression, such as Native, Black, or unhoused communities. That being said, with wider scale knowledge and application of drug analysis machines, websites like this, and resources like this, community organizations may be able to help provide testing and help be able to provide information to the community members about what's in their supply. And so the good news about everything I just mentioned is that there's actually nitazene and benzodiazepine test strips already available for purchase. And so if you are a community organization and you have a little bit extra money and you want to make sure what's in the supply going around your community doesn't have nitazene or benzos, or if they do, that at least you'd be aware of it, you can actually go to that website right there, btnx.com/harm reduction. It's a pretty simple link, but it brings you to all of their test strips, everything they offer. They offer fentanyl and xylazine test strips in packages of 10 or 100, so it's even available for people who are just users themselves. They don't have a whole lot of money, but maybe like 15 bucks. They can spend on a pack of fentanyl or xylazine test strips, get sent to their house, and that can help keep them safe. And for community organizations, they offer more larger count boxes of test strips. And so, unfortunately, the nitazene and benzos are also available are only available in 100 count boxes. But with these test strips, that gives any community organization with the ability to purchase this, the ability to let their community members know if any nitazene, benzo, xylazine, or fentanyl is in any given pill. And having the ability to test multiple substances like that instead of just the one makes it much more safer to be a user when you have that information. Having the ability to test one substances enables one to choose which substance they want to do and gives agency back to the user. I think a lot of the time that little section gets swept under the rug or forgotten about a little bit, but users are just people too. They're just people who use drugs. And so we want to maximize the freedom and the agency that each and every person has, whether or not they use drugs. And so if they do use drugs, one way to do that is to be able to let them know what's in their supply. And if you know what's in your supply, do you still want to take it? And these are questions that it's up to each and every individual person, but it empowers them to even be able to be asked that question. And the current opioid epidemic is not a perfect solution, but it is another tool we can use to empower our communities in the midst of this crisis. Reagent testing is also a useful tool in determining what is in one's substances. Through reacting multiple different reagents, which react in different colors depending on the substance it's reacting with, one can determine what substance one has. To test, simply you lay a small amount of your substance, like in that one of those little holes right there, and put a drop of different reagents where your substances were, and they'll react to different colors. And based on the colors they react with, we'll know exactly what's in it. And that sounds a little bit complicated, but an example may help. So for example, if one say, I want Adderall, I want to study, I got this big test coming up, I want to go buy Adderall. And so I did. And I brought it from my friend who just said he had some Adderall pills. This Adderall could be real, or it could just be pressed with meth. I don't really have a way of knowing, unless I use reagent testing. With reagent testing, I can take a little tiny piece of the Adderall pill, scrape it up into a powder, and then put a little drop of a marquee reagent on it. Now I do this first, and this will react orange in presence of amphetamine or methamphetamine. And so that tells me this Adderall is either amphetamine or meth, so it's generally what I was looking for. You know, it's maybe a little bit more potent than I was looking for, but it is the type of drug I was looking for. And next, I'll react it with the Simon reagent. And meth reacts blue with the Simon reagent, but Adderall does not react at all, or amphetamine does not react at all with the Simon reagent. So this will tell me that the first one tells me I have either Adderall or meth, and then the second one tells me with the Simon reagent that I definitely don't have meth. It did not react blue, it did not bubble at all. This tells me that meth is not present. So the only logical thing that could be left is amphetamine, therefore telling me that my Adderall is safe to take. So reagent testing can be very useful for situations like that where you want to know if what you have is truly what you have, or you have a very specific substance and you want to make sure you have what you were sold. However, in the opioid crisis, it is less useful. And the reason is, a lot of the times, like we saw before, in any given M30 pill or in any given powder, there's 8 or 9 different chemicals. Some active, some not. Some fentanyl analogs, some nitazene analogs, some what you're looking for, some not. So any of those chemicals, those drugs, are going to react with those those reagents all at the same time, giving you an incomprehensible result. All that you know is that there's more than one drug in this pill, which, can tell you something, but it doesn't tell you whether or not it's super potent, it doesn't tell you whether or not it's safe to take, and it's still up in the air as to what was in it. However, there are uses in the opioid crisis for reagent testing. And this generally is testing whether or not you have you have a prescription, a legitimate prescription that you think you have. Say I went to that same friend and he sold me legit Adderall the first time, so I'm like, okay, I like this guy. I will go buy some oxycodone pills from him. And if I want to be safe again, I'll go home and I'll test that. If that reacts as a bunch of muddy different colors, that probably tells me this is a black market pill, because this has multiple different substances and does not have a clear reaction. However, if it's a genuine oxycodone pill, our reagent should be able to identify that and react a very specific color. As long as I know the color it should react as, then I should be able to look at the color, look at the reaction. If it matches, I'll know that I have genuine oxycodone. Most pills in the illicit market are pressed with a mix of potent opioids and other cuts, making confirming the authenticity of prescription opioids the most common use for reagents. There are other uses in general for reagents. They're just generally useful for anybody who uses any sorts of drugs, but they tend to be more useful for testing things like MDMA, Adderall, things that generally not opioids. And recently we found an industrial chemical in the dope supply. And when I say recently, I mean over the past few weeks to months, very recently. The most recent update to the supply was an industrial chemical being found in fentanyl across the country. This chemical is reported to cause blurred vision and nausea when ingested, as well as a very, very strong bug spray, burnt plasticky kind of smell. It was first found when there was a program testing the supply in Los Angeles and Philadelphia, and the chemical was not found in the supply at LA at all in June. It was 2 months ago now. But by August, just last month, was in 41% of the samples detected in LA. That is an enormous increase, and we don't exactly know why. But what we do know is that it is a non-psychoactive drug that is being put into the dope supply, and we, with testing services, are able to catch this. So with, say, test strips, fentanyl testing strips, xylazine testing strips, you might not know if this is in your supply. But if you're able to send this off to testing, either to drugstata.org or to a more local community organization that has a testing facility with them, you're able to see whether or not this is made it into the supply. And generally, again, the more wealthier areas, and the one like LA, Philadelphia, these are going to have more services, and they're going to be the ones detected first because they have much more wealth, generally, to serve the communities that they need to. But what we do, even though it's best to use the examples towards more wealthier areas, we do know that it's popping up in the supply somewhere. And that can let us know to our community members, if you're using And you smell it, if you're using, you like light it up, and there's a very intense bug spray plastic smell, and you get blurred vision, it's most likely this. And we can't say that for certain, but we can look at trends and like inform our community based off those trends. I can't say for certain whether it's made its way to Albuquerque, where I reside and work, but what I can say is that I've seen a lot of participants come in very recently with bloodshot eyes or something in their eye. It's some kind of issue with one of their eyes. And at first I was a little bit confused because it seemed to happen very suddenly that a lot of people are coming in with eye problems. But now it seems to be like this is the cause. And again, without drug testing, we would not have known that. We would not have been able to even imagine that would have been the problem. But with drug testing, we can isolate certain problems and then find those same chemicals in different supplies across the country. So staying up to date is also very important in the opioid crisis. And drugs data is the one I was talking about earlier, it's the website I was talking about earlier. But that can help stay informed about what's in supply. Psychoactives is another website here that I have always found very useful. It's basically just a Wikipedia, pulls most modern drugs, and it has the threshold dose, it has like the duration of action, how safe it is, the pharmacology of it, all the things you would need to know about any particular drug, the dosing information, everything you would need to know is in this website. And also following substance-based subreddits. And I know this sounds a little bit strange at first, but people who use substances and have first-hand experience are the ones who are going to be able to inform us best about what these drugs are like, about the dangers of them, about what we should know. And it's important to listen to those who have lived experience and give us a better understanding about these substances. The most common, I'd say, and the most important ones to look at for anybody in the field of harm reduction is number one, Opioid_RCS, and that stands for RCs, which stands for research chemicals. This has been very, very interesting to look at as somebody working in the field of harm reduction, because I can see people order some opioids over the internet, get them, talk about them, post about them, and then a few months later I can see them pop up on drugs data. So it really seems like this subreddit is full of people who have very high tolerance to opioids, are using very potent opioids and spreading information about it to each other so they all can know what's the safest one on the market right now. How much should I be doing? How do I taper down? Things like that, all the information is right there. The second one, r/research chemicals, it's less focused on opioids, but is more focused on everything that's on the market right now. All the designer drugs on the market, anything that is not made by a pharmaceutical company on the market, this is where you'll find information about it. It's members of the community, people who use drugs, talking to each other about these drugs. And that, far and away, is the best place to find information, is people with lived experience. And finally, harm reduction. Generally pretty useful, has different harm reduction groups from across the country, post about different things going on in the field, different supply changes, different problems with even funding or whatever. All that kind of stuff is in harm. And I appreciate y'all coming. And if anybody has any questions, I'd like to open it up for a kind of Q&A period now. But if you have any questions later, you can always email me here, and I'll make this presentation available as best I can by sending it to the people who run this, and then hopefully they distribute it outwardly to everybody else. Is there any questions? Okay.
Is there like a drug list or in the subreddit of slang terms? Because yeah, we can use all the chemical words and the professional
For
words.
sure.
But like on there, I saw things I don't think I've ever seen. I saw like DraftKings. Like,
right.
I know that's like a sports betting thing, so I was like, what drug is that?
For sure. So what I think the best place to find that there would be the subreddits, because they're going to be like talking to each other in the language they use, not in the language clinicians would use, but in the language these people use. Also, Psychoactives is a good resource for that, because it has most popular drugs, anything that has come out in the past like 2 years. It is listed on the Wikipedia page, has like all the slang terms, dosing information, everything like that. So that's a really good question, for sure. Any other questions?
When you work with individuals, how likely or what's their response when you talk about like, the testing? You said the testing strips or the other one with the...
For sure. So reagent testing?
Yes.
So reagent testing tends to be more popular with our clients who aren't using opioids, but more party drugs like MDMA, things like that. That tends to be more useful for them. And when it comes to our fentanyl testing strips and xylazine testing strips, on the other hand, this has been something that's becoming more popular among our clients who use opioids. Almost 50% come in and ask for test strips. And I think a big reason about that is just we've been offering it more, we've been trying to get the word out, but also I've been driving through Albuquerque and I just see bus stops saying like, ask for fentanyl testing strips. And that is a great place to put it because, I mean, bus stops are utilized by unhoused folks in active addiction. So that is a great place to put information as to how they can stay safe. But yeah, we've seen a lot more people over the past few months. It went from maybe 5% of our clients to maybe 50 coming in and asking for fentanyl testing strips. So that's been really good. Okay?
Hi. I'm sorry I came in late, so
No, that's okay.
I missed the first few minutes.
For sure.
But I work in a school setting, and I work with middle school and high school age, and I'm just wondering if you had any reports or statistical reports from the Navajo Nation about how our youth might be using fentanyl or things like that.
Right, for sure. I don't have any information regarding youth use any more than like my personal experience of like seeing youth come in. Honestly, it is a bit less common than one might think, which is a little bit relieving to me. But we do have people come in, maybe 1 out of every 50 clients is born under the age of 18. But most of the people who come in are definitely above the age of 18. The ones who are not, I tend to be a little bit more patient and kind, and I try to give all of my time and attention to, because it's really hard to see kids and stay like that. But I do tend to see a few kids come in, but the ones that do come in are very safe. They're coming into a syringe exchange and they're getting all the supplies they need. They're getting cottons, cookers, and like the tourniquets. They're getting everything they could possibly use to make sure they're safe and they're not like spreading anything, and they're not sharing anything. So I do think that our youth, the ones who use, are from my experience, they tend to be aware of the dangers and aware of how to stay safe, even more so than some of the adults. But I don't really have any statistics about the youth use. But that was a really good question. Okay.
Are you seeing amongst the population in general acceptance of like even if there is xylazine in their normal fentanyl supply, that they're just still willing to use?
Yeah, that's probably the biggest issue. Is even if you have a supply that's tested negative for fentanyl, and one day your batch tests positive for xylazine, and even though it's tested negative before, you have a choice to make. You can either stay well and not immediately go into a deep withdrawal, or you can go and try and find some xylazine-free stuff. But the chances of that, not exactly in your favor. So we do tend to see, even though supplies have chemicals and drugs that people may not want, it's not like they have much of a choice a lot of the time. So we do still see them use anyway, because they don't have a whole lot of other opportunities to choose clean fentanyl. However, the more we can still provide testing and resources for testing, I think, the more people can stay aware. And in my mind, the most important reason we want to test and keep updates on batches is that we know which batches have xylazine in them. So we can let our community members know, hey, avoid like this specific thing, because this specific batch being sold is what has a lot of the negative chemicals in it that you don't want. That's a really good question.
Well, I was just trying, I'm from Arizona, and I'm just trying, because yeah, we see that too, but we're trying to, I guess, I guess, break a wall and do harm reduction within harm reduction and say, okay, we understand you're going to use this. What are other techniques we can give to people, because we are seeing massive amounts of wound care. We're
Definitely.
seeing people lose loss of limbs. We're seeing higher healthcare costs because usually the people that are using also have compounding issues with other mental health, and now they've lost a limb, now they need care. It's just, is there other ways to provide additional harm reduction within harm reduction to say, hey, you used it, fine, whatever, we understand. Now you developed a wound on your hand. What's the next steps? Is it bandages? Is it
For sure.
care? Things like that.
So I actually did attend a Zoom meeting the other week about wound care regarding xylazine. And one of the biggest things, or the biggest thing they drove home to us, was to not let the wound dry out. If whenever available, antibiotic cream and a bandage, but even anything that keeps it moist, lotion even, anything that doesn't let it dry out is going to help prevent it from like necrosing further and from getting worse. The moisture allows it to heal and to like start to make progress on not having the wound spread. But outside of basic wound care and like providing plenty of like water and maybe some snacks for the person to be able to like help eat and like heal their body, it's hard to really provide anything else, I think.
Yeah. Okay. Thank you.
For sure.
So, so like I live here on the reservation in one of our local communities, and I'm thinking like some of our best ways to provide harm reduction is some pop-up like tents, especially where we're seeing a lot of our relatives who are kind of like I live in Fort Defiance, which is about 5 miles from here. And so since moving back from the urban setting, I've noticed that a lot more of our relatives are hanging out at the local convenience stores now. And that's here in Window Rock and Fort Defiance as well, on a daily. So different days call for different stages of whatever they're on, be it could be alcohol or it could be, I know meth is one of the biggest here, and a combination of both of those, right? So again, having pop-up tents for just the harm reduction, the education of like, we may not know what you're on, but here's some resources. Like,
absolutely.
Is there a way we could work with your department, and especially within our Two-Spirit LGBTQ community as well? We're wanting to do a little bit more outreach, a lot more outreach in that with the community as well.
For sure.
So alongside that, I'm noticing, so with the help of you all and these wonderful resources with the websites, are these test strips or test, like the reagent testings, are those available for us, like if we're nonprofits working within this realm?
Yeah, so depending on where you get it from, yes and no. But most of most like this website, for example, offers much stronger discounts to nonprofits than even like for-profit organizations. So like where I believe a box of 100 is like normally, or a box of 100 benzodiazepine test strips is normally like $75. I believe for us it's like 30 to 45. So it's almost half.
Okay.
So which is an extraordinarily like helpful thing in getting able to get like multiple different test strips and being able to go out into the community and provide those. As for being able to do more like community-based outreach, I think providing test strips and Narcan are generally a lot of the biggest thing. Obviously clean using supplies as well, but providing Narcan and community outreach tends to be the most important, because it's getting Narcans into the hands of people who are going to use it, and not necessarily like somebody might come in and like take a few and maybe like use a few, but getting it usually to people like at the place they're using it allows them to keep it on hand, keep it at camp, keep it where they need to. And that drastically increases the usefulness of Narcan. And I can also give you a card from my manager, and she can talk to you about stuff like, stuff like partnering or being able to see what we can do together, because she runs the department. But absolutely, if you want to reach out to her, that'd be wonderful.
Just another add-on to, like, I know also there's the cultural perspectives, also living from an urban setting, thank you, to living within an indigenous community. Just those stigmas as well, the cultural stigmas, because like these are things we don't, in our communities, we rarely, if anything, you know, now more so, we never talked about before, because that was that's part of our generational trauma, right? Is we don't talk about things like this, like sweep it under the rug, like this isn't family time talk, so to speak, you know. So, but now it's becoming more prevalent, and so it's also breaking that barrier or breaking those stigmas of that. You know, some of our relatives are using, they're in active use, and they will use needles, and they will need these types of things. So I feel like the thought is, but we're just, we're also like encouraging them, right? But it's like, but in a way where we may think that, but really we're saving their life.
Absolutely.
So I think we have to change the perspective of what we're seeing.
Absolutely.
And so I think by going into our schools, you know, it is something that's so important for us to provide Narcan. What is Narcan? I literally just learned over the weekend that, you know, you can't use Narcan on a person who is who's drinking alcohol, just pure alcohol, right? So like, not that I didn't think it would work on them, but it was just more reinforced that we have young people, maybe what if their parents are passed out and they've heard about Narcan and they're like, oh, maybe that's what happened to my parents, so let me try the Narcan on them to wake them up, right? So it's the education that goes back to that. So
definitely.
I think resources like this are super important for us to learn about, but I think it's just also breaking those stigmas that we need to talk about it more.
Definitely. Education is perhaps the biggest thing with making change, cultural change, because with proper education about like just being told like straight up like the truth of the matter, especially as children, we don't tend to want to, because they're kids, right? They're like innocent, they're our babies. But telling them the truth of the matter, like there's dangers around here, but there's ways you can stay safe. There's ways you can prevent yourself from going down similar paths that maybe the previous generations did. And I think with proper education and proper outreach, being able to talk to our kids and properly educate them, give them Narcan, provide Narcans to our schools, make sure it's in there so if a kid ever overdoses at school, they're prepared. The other kids are prepared. The teachers are prepared. They know what to do. Versus in the past, where we just didn't know what to do. There is not much we could do. But now that we have Narcan and much more education, where there's a lot more that we can do.
I think like working in the schools is kind of like we don't really receive any reports about, you know, what's going on in our community, or, you know, and I think if we see numbers that, hey, you know, there was a kid that, you know, experienced this in our community, I think that the response from the school level would be, you know, a little bit higher and, you know, be more involved.
Absolutely. I think educating educating through the schools is extremely important. When I was growing up, that was one of the biggest things for us. I grew up in Ohio, which was kind of like around the heart of the opioid crisis when it first started happening. So I remember school assemblies in middle school telling us like, basically going over like the last class or like the last generation before you, like the people who grew up and like were in the same situation that you did, made mistakes and they ended up in bad situations. And here's what you can do to not repeat those mistakes. And even like, we didn't have the education we have now, and it was less robust than it was now, and it was a bit simplistic. But even being told that as a kid and like not being lied to, but just being told straight up, we have a heroin problem here, it's real. It's something you take as a kid. It sits with you and you are less likely to use. If you understand that it's a problem, you understand the dangers, you understand the education behind it, you understand what it does to communities and families. You may not have all of the understanding that an adult would have, but you're also much less likely to use if you understand all those things than if you don't. Right?
It's not really a question, just more of a comment. At least in Arizona, I would say think this topic, because it's not like something we can, like, general public can get around and be like, yeah, no, definitely you should have insulin because you have diabetes. Like, it's not really something people can say, oh yeah, well, you use drugs, obviously you should have naloxone. It's a politicized topic, and just from my perspective, I work for the Arizona Department of Health Services. We're going to equip our Arizona Department of Education with 16,000 naloxone kits to give to all of our schools.
Wow.
We're going to do that in this week, but there's already pushback because it is so political. Because people don't, because schools aren't equipped, they don't want to use it, they're worried about liabilities. We have the state statutes, we have the standing order. I don't know how it is in New Mexico, but we have all of that, everything's in place. We have an interesting board of nursing that is its own situation, but like, we're already getting pushback, and we just are supplying a product that's going to be good and helpful, but parents don't want it in their school systems. And the schools are run by parents as opposed to advocates and good teachers. Well, that's like next to me and saying, well, you might not want to hear it, or you don't want to talk about it, just like anything else when it comes to anything transgender rights or bathrooms. Like, it's not your place to talk to my kid about it. But then they come to the school upset when their child overdoses and there are signs and for things of that nature. So it is going to continue to be a political topic. Obviously, we're all working to address that stigma, but I think even with the work that we do, there's still going to be people that have that outlying, like, that's not my kid, this doesn't happen in my community, you know, that's for the weak.
Definitely.
Yeah.
I guess that's why education is so important, is just spreading awareness. But I'm out of time, but I'd like to thank everybody for their time and attention and participation.